Dialysis patients are on dialysis because their kidneys have failed and therefore their fluid management is very much a challenge.
And when that happens, we have to replace that function with the machine. If the salt and water is not limited, we have to do a lot of work with the machine to remove those things, and that can be harmful to the patient.
They are already facing a lot of different modifications to their regular diet. I think one of the hardest things with reducing sodium in the diet is it's kind of an all or nothing change.
Some of the challenges that patients can have is their stress level, depression, anxiety. All these negative symptoms can affect their daily functioning. It can affect their daily mood, and especially it could affect their social relationship with others.
The dialysis patients will typically tell you that they didn't understand that certain food items were high sodium content. It's gonna be just like being a dialysis patient. When I first was asked to do the challenge, I made every excuse in the world why I shouldn't do it, but for the sake of, understanding what my patients go through on a deeper level, I'm all in.
It's going to be really challenging. I know that my palate is particularly sensitive to salt, and I enjoy it.
Discipline is hard. I like to eat, and I like to eat good food.
I am very interested to see how it goes and to be able to walk just this tiny little bit in my patient's shoes.
So today went well. Just went shopping here and picked up some fresh ingredients for dinner.
It's almost dinner time on day one, and I'm in the kitchen trying to whip up a tasty dinner that's low in salt.
Today is my third day of no sodium. This morning for breakfast I had a bowl of fruit, and for lunch we spent some time with the family and got some dim sum. I feel like my food is getting plain and boring. I'm not as excited eating as I used to be.
I just had guacamole tonight. It was a potluck and there were chips and there was wonderful guacamole, and so I ate it. And now I recognize how hard it must be that when you live life with dialysis, that when on a weekend you eat some guacamole, next thing you know, you want to drink out of the faucet all night.
So I tried to follow exactly what I would teach to a patient, is to try to find, ways to fit in the foods that they most enjoy in a healthy, reasonable way.
Health-wise, I feel the same, but emotionally I feel drained. I feel like mealtime I'm not as happy.
So I got the full benefit of what a patient felt like. And towards the end, I actually had to pull my staff in and apologize because I couldn't help it. I was just not feeling well. So now, relating that to my patients, when they come in, it's easy for me to see now that, any small change in their treatment or their diet could affect their overall mood.
A message that's a good one for patients is that dietary changes are challenging for everybody, doctors and healthcare providers included.
Approaching anything that we do to patients in a way of how it would feel if we had to do it probably makes us better caretakers. And so that means for all of us as healthcare providers that our conversation gets onto a very different level. We talk about shared experiences. Everything that we have an experience, the healthcare providers will have a very different conversation with patients. And that makes for a much more loving and compassionate environment.